the confirmation of Robert F. Kennedy, Jr., as the next Secretary of Health and Human Services marks a watershed moment, deeply dividing the nation and raising serious concerns about the future direction of America's healthcare system. His appointment, secured with a narrow 52-48 Senate vote, places one of the nation's most prominent and outspoken vaccine skeptics at the helm of a vast and complex healthcare apparatus valued at over $2 trillion. This unprecedented move has sent shockwaves through the medical community and sparked intense political debate, highlighting the deep partisan divides currently fracturing American society. The vote largely fell along party lines, with all Republicans, except for Senator Mitch McConnell of Kentucky, supporting Kennedy's nomination. This stark partisan alignment underscores the increasingly polarized political landscape and the significant influence wielded by the Republican Party in shaping the direction of critical government agencies. The confirmation, therefore, represents not only a victory for Kennedy and his supporters, but also a testament to the power dynamics within the current Senate. Kennedy, a former environmental lawyer who abandoned his independent presidential campaign last year to endorse Donald Trump, brings a controversial and complex history to this critical role. His long-standing, vociferous opposition to vaccination, fueled by his public campaigns and numerous lawsuits against various health agencies, is now set to place him in direct control of the very institutions he has consistently challenged. This inherent conflict of interest has become a major point of contention, raising legitimate concerns about potential bias and conflicts of interest in the decision-making processes of the Department of Health and Human Services, HHS. The appointment grants Kennedy sweeping authority over virtually every aspect of the nation's healthcare system. His purview will encompass the approval of new drugs, the administration of Medicare, and the overall direction and policy of numerous vital agencies, including the Centers for Disease Control and Prevention, CDC, and the Food and Drug Administration, FDA. These agencies, tasked with safeguarding public health and ensuring the safety and efficacy of medical products, will now be under the leadership of someone who has actively campaigned against their core mandates. The Senate Minority Leader, Chuck Schumer, eloquently voiced the deep reservations felt by many regarding Kennedy's qualifications. Schumer stated emphatically that Kennedy is not remotely qualified for the position, asserting that he may be one of the least qualified people the president could have chosen for the job. This sentiment reflects the widespread unease among many healthcare professionals and public health experts who fear a potential erosion of scientific integrity and public health initiatives under Kennedy's leadership. Senator Elizabeth Warren, during the Senate Finance Committee hearing, further amplified these concerns by highlighting Kennedy's significant financial entanglement with anti-vaccine litigation. She pointed to a lucrative fee-sharing arrangement with the law firm Wisner-Baum, which generated $2.5 million for Kennedy over a 3-year period. Initially, Kennedy intended to maintain this arrangement while serving as secretary, a plan that was met with considerable backlash and ultimately led to a revised ethics agreement under intense pressure. This revelation underscores the potential for conflicts of interest inherent in Kennedy's appointment, raising serious questions about the ethical implications of his position. The implications of Kennedy's appointment extend far beyond partisan politics. They impact the health and well-being of all Americans. His long-standing skepticism towards vaccines and his history of promoting misinformation threaten to undermine public health initiatives, potentially leading to decreased vaccination rates and increased susceptibility to preventable diseases. Furthermore, his control over the FDA and CDC raises concerns about the future regulation of pharmaceuticals and the integrity of scientific research conducted by these agencies. The confirmation vote has exposed deep fissures within the American political landscape, highlighting the growing influence of anti-establishment sentiment and the power of misinformation in shaping public opinion. It represents a significant departure from traditional norms of scientific expertise and evidence-based decision-making in public health, raising profound questions about the future direction of American healthcare and its commitment to evidence-based policy. The appointment's long-term consequences remain uncertain, but its immediate impact is undoubtedly one of heightened concern and uncertainty among those dedicated to maintaining the health and safety of the American people. The coming months and years will be crucial in assessing the impact of this controversial appointment on the nation's public health infrastructure and the overall well-being of its citizens.